Okay, if we want to work with patients to improve the ways in which, or help them take medicines in ways in which are going to help them better, this really is very much a behaviour change problem, because taking medicines is a behaviour. So crucially, what we need to do is understand what drives that behaviour. And there are a lot of factors, clearly. There are many, many factors, but there are two key ones that we need to address if we're going to work with patients effectively. And we can perhaps call those a perceptions and perhaps, if you like, a practicalities approach. So the perceptions really is very much concerned with the level of motivation that the patient has for taking this particular treatment. And this really goes back to understanding their beliefs about the treatment, and particularly their beliefs in the treatment and any concerns they may have about it. Now, obviously, patients, for a patient to take a treatment, they need to be signed up to the idea this treatment is going to help them and it's not going to cause them harm. And that's fundamental. So if patients believe those things, we need to address those sorts of beliefs at a very early stage and in a very individualized way. The other crucial thing we need to address is the more practical aspect of medication taking. And we know that many reasons why patients may not take medicines is they may forget, they may miss out doses, they may not adapt their routine in a way that allows them to take medicines in a fairly effortless and daily, a routine-like way. And so there are sort of very practical issues one can address to help patients take medicines. For example, if one's dealing with a patient who's being asked to take medicines twice a day, once in the morning, once in the evening, linking the taking of that medicine to a regular daily activity in a particular place, for example, brushing their teeth in the morning or brushing their teeth in the evening, making a cup of tea in the morning, making a nightcap in the evening, and having the medicines linked with that activity so the patient knows the time and the place and can have that as something which is sort of logged, if you like, inside them. That can make a huge difference. And then as that becomes routinized, then the whole business of having to think about medicine taking begins to disappear. It becomes habitual. Now, that's the relatively easy bit. And if we only focus on that bit, we're not going to have success. And I think this is one of the great lessons we've learned over the years, is that I think a lot of earlier, cruder interventions to help patients with medicines have only focused on those practical aspects. And the problem there is that we can focus on those things, but if the patient doesn't really believe this medicine is going to be helpful or has major concerns about it, just focusing on those practical aspects is not going to help. So the two very much go together. We need to focus on patients' motivation and their beliefs, and maybe work with those if there are issues there. And then once the motivation is in place, then to ensure that the practical aspects of medication taking are also ideal for that patient, to find out ways for that patient just to help them take the medicine in a very manageable way on a daily basis.